What skills do you believe are required for this program?
Why did you want to become a doctor in the first place?
How do you describe your style when working with patients?
What is the overall state of doctors and the medical field today, especially with regards to all the talk about artificial intelligence?
Hi, I'm Dr. Umer Khan, and I am done with my internal medicine residency. And these are some of the common, yet a bit atypical questions that you can face in 2024 and beyond. I'm going to be giving you some brief sample answers for these questions so you can be ready for your residency interview. Make sure that you do adjust them to your particular situation. All right, what skills do you believe are required for this program? Now, this question is actually an opportunity to highlight the skills that you have honed during your education and your internships. So you will be looking to focus on your strengths, and you need to have an idea of what a clinical situation requires, what a clinical practice requires, what a hospital setting requires. So you're going to talk about your experience and skills that are going to be used in a residency program. You can, of course, always share a practical example and a personal experience that can effectively be used or utilized for what is needed in a residency program. Now, this is the sample answer. I believe this is an excellent question because everybody who is looking for any job or any role for that matter needs to be fully aware of what are the requirements to operate properly in that given position. And I believe that some of the attributes that you definitely need to have are, I believe, number one is going to be time management. And number two, which I believe can interchange with number one, is effective communication. And these are crucial skills for working in an internal medicine busy practice setting or a hospital setting. Now, good communication, let's talk about that, helps in connecting with patients, especially when there is a lot of uncomfortable situations that happen in the hospital, especially a lot of nervousness. And you need to be able to communicate effectively. You need to know what is happening in your mind as well as in the mind of the patient and the family members. Then effective time management is an essential aspect that I believe any resident will need to have. Now, effective time management ensures that you are mindful of how much time you spend with each patient and with each problem. And you need to know, you need to adjust yourself with, okay, this is a sicker individual, this is an ICU patient, and I need to be much more detailed and make sure I'm not missing any of these lab values or anything else that could be pertinent. So it is about balancing the needs of the patients while working efficiently at the same time. And these skills are essential for the success in any program. And I believe your program is a strong example of a program that is looking to generate capable, able doctors for the future who will be able to work in any clinical setting. And I do believe that I could be the right person for the job. Thanks for asking this question. Hopefully you got the gist of how I would look to answer this question. This was a more generalized response, but I believe keeping it generalized, and they would respect that you know that you have to be an effective communicator, especially in a medical residency. Of course, it could be any residency program. However, hopefully this was helpful. Let's get on to the next question. Why did you want to become a doctor? What actually got you the impulse to, join medicine? Now, this question is a chance for you to share your career aspirations and how a residency program aligns with your goals. Now, talk about what ignited your passion in medicine. Was there a particular mentor or was it a particular experience? Make sure it is genuine because it has to be real for you to actually sound genuine. And highlight your core values and how they guide you in making your crucial decisions, showing how the residency program can help you grow as a medical professional. Now for the sample answer. All right, actually, that is a great question, and that is truly rekindling some of my old memories, but definitely I can pin it down to a certain moment. And when I was in high school, we had to do a school project that for a month we had to shadow or be part of a career path that I may want to explore in the future. And one of my uncles was a ICU nurse, and he agreed. And when we went through the volunteer process for the hospital, and I was able to shadow him, and this experience made me realize that this is what I want to do. and the ins and outs of a hospital ICU environment. Although there were many stressful moments, and I went through the experience of observing different medical issues come in and out of the ICU, and this was exhilarating, I would say, in one respects, as well as a bit intimidating. You would agree that a high schooler may have a difficult time fully appreciating what is happening in the ICU, but that led me to experience that I could possibly have a positive impact on others, and I could look to deliver masterful and compassionate care. And I do believe that I have that ability and the intellect for that. And I believe that completing a residency program at your place and the extensive experience that I do believe I will obtain in the ICU in this hospital will lead me to further develop my skills. And that is probably what I want to do in the future as well. Nothing is written in stone. However, I think that was the moment, that was the experience that led me to pursue medicine. And I hope this answer helps. And I do want you to actually bring in something personal so that you can talk about it personally. Anyways, next question. Dr. Khan, how would you describe your style when working with patients? Okay, so this question allows you to discuss the methods and techniques that you can provide, for example, medical advice or going over treatment options. How do you actually look to communicate with the patient? So describe your patient care approach in a few words, a few sentences, and look to share a specific experience that could potentially illustrate your style a little bit more. Now let's get to the sample answer. That is a very good question, and I believe that is at the crux of a medical profession because the human touch can heal a lot of illnesses. And I do believe that I would describe my style as more empathetic and adaptable at the same time. I do believe that people, just like myself, and patients especially, they could be having different moods. Some could be in distress, some could be significantly anxious, few may be comfortable, few may have a lot of things on their mind that are in addition to the medical issues that they are facing. So I usually look to gauge a patient's or a person's mood or comfort level at the start of our interactions, and which then influences my tone and my rapport building approach, because a doctor has to look authentic, genuine, knowledgeable. So you definitely need to be having that ability to judge the situation and read the room. The ability to read the room is going to be of paramount importance for any physician. So this personable style helps me connect better with my patients, which I believe would be an asset during my residency here. And I hope to put my best foot forward in your residency program if given the opportunity. And I believe as a medical student, there was a highly irate pain medication seeking patient that initially looked as if she is pain seeking. However, my empathic approach led to a further discussion that she did have a lot of medical issues and an accident about 20 years ago that led to being addicted to medication and opiate medication. And I explained to her that I'm here to listen to you and I will relay all of your concerns to my team, and the team will look to work together with you to try to help you out in your particular situation. And that helped resolve the situation. The nurses were actually happy that a medical student was able to communicate this effectively. Anyways, just wanted to share an example, but this is how I would look to approach my patients every single day. Okay, hope you like this answer. Make sure you do have some example, but I believe this would be a proper answer. So do think about this answer. Next. Dr. Khan, what do you think is the state of doctors and healthcare today, especially with all the talk that is going on regarding artificial intelligence and its implications on healthcare? What do you think? All right, this is a sort of an atypical question. However, this tests your understanding of the medical industry and your ability to form a well-rounded perspective. So you have to have some level of idea what is happening in the medical industry, especially in the specialty that you are applying to. So this could be a general answer, but I want you to follow the following structure. Of course, you can definitely should adjust it to your particular situation. Let's go over the sample answer. Thanks for asking such an interesting question. And I do believe that the healthcare industry is constantly evolving. And with the last 2-3 years, with the advent of AI and natural language processing, I believe huge changes are going to be in effect sooner rather than later. And having said that, the role of doctors and good doctors and able doctors is increasingly vital to address the complex medical issues and concerns that we have. And along with that, the doctor needs to be a quick learner and flexible enough to adopt and learn the new technologies that are going to be coming into the mix. And as telemedicine came along in the last 5 years, and we have adopted that fully, and we have figured out the use cases for telemedicine, I believe artificial intelligence will be coming to the forefront of this medical experience. And this will affect not only patient care, but how we operate as a physician, as a clinician, as a surgeon, as a medical professional, as a nurse. And I believe different aspects of our care may be automated, but for the better of patient care. That's what I believe. And I definitely welcome this as a positive thing, because I believe just as a stethoscope is an extension of my ability, likewise, artificial intelligence and all the tools that it is going to be bringing will be an extension of my ability, and I will be able to operate and manage my patients quicker, in a more efficient manner, and with better patient outcomes. And I do hope that the healthcare industry gradually and cautiously adopts different types of technologies, of course, making sure they are effective and we can implement them in the best manner possible. And I'm looking forward to this world of changing medical practice. And having said this, I'd like to keep myself up to date with all the different advances that are taking place in the health tech and the digital health world. And I want to be a first mover in this regard. So you will see me to be on the medical floor, really active and trying to learn all the new skills that I would need to learn. That excellent question. Thank you so much. All right, hopefully this was helpful. And I think you need to have a reasonable answer, because there are going to be changes happening in healthcare with the advent of artificial intelligence and natural language processing. Hopefully this answer was helpful. You need some more help looking to connect, then I will have links in the description. And you can probably find my 25 questions and answers, a PDF. Gives you the questions and the answers, and you can practice on your own. You need further help, you can check the link in the description as well. Possible sessions with small groups, as well as possibly one-to-one. And if you want to become a member of my channel on YouTube, and we will be having live interview preparation sessions as well, consider becoming a member there as well. And of course, we'll chat over on Facebook as well. I will have all the links for all of my social handles in the description. Hopefully it helps. Thank you.